is Rachel, and I'm going to be speaking about cranial sacral therapy with special focus on the sphenoid this evening. So, is anybody brand new to the concept or the work, cranial sacral work? Great. Great. So I'll just give like a brief bit of words around that, although the best way to really learn about it is to experience it. So cranial sacral therapy grew out of cranial osteopathy, which was born in osteopathy. And it's a way of working with the fluid body, working with the flow of the cerebral spinal fluid that surrounds the brain and the spinal cord. And the whole body is in a subtle dance in response to the flow of this fluid. And where we find restriction in the body, injury or trauma or difficulty, we find the body's inability to respond easily and as it should to this subtle rhythm. And you can palpate this anywhere on the body when you learn to sense for it. It's a very subtle kind of a thing. The heart of the work, for me and for many others, is around helping restore balance and equilibrium from the deepest place of knowing and wisdom in the person. So one of the pillars of the work is that the body is always tending towards health. We know how to resolve our own issues. Sometimes we need a little bit of encouragement and guidance, but that really the work is coming from within the person who's receiving the work, which is conceptually sort of at the other end of the spectrum than Western medicine right now, as we're looking to mask the symptoms from the top down, whereas this work is really bringing healing and balance from the root, from the source. So it doesn't feel like a massage, like the kind you would get at a spa. It's not really about moving the muscles or really moving anything at all. It's a practice of deep listening and helping follow the body and different structures in the body restore them to their natural, healthy motion possibilities. So I brought my skull, so maybe I'll just pass this around and you guys can just sort of hold it and check out the bones. We work a lot with the bones of the cranium, the bones of the skull, which all are movable. They have, these are actually little joints in between these bones, and you can feel the way all the bones relate to each other. And there's a particular bone I wanted to talk about tonight, because last time was a little bit of a general introduction. I thought I'd get a little specific on us just for fun and for interest. So the bone I'd like to highlight this evening is called the sphenoid bone. And this is what the bone looks like. I'll pass this around as well. This is a plastic replica. When you look at a human sphenoid made of real bone, some of the areas of the bone are so thin that you can see through. Very, very thin. So where this bone lives is in the center of just behind the eyes. So the only place you can contact the bone from the outside is on the temples. If you look on the full skull, you'll see, if you look sort of behind, see where the eyes are, and you look right behind there, exactly where Victoria is pointing right there. Where that side part is this. It's the greater wing of the sphenoid bone. So the significance of this bone is great on many levels. One is that it's the only bone in the cranium that articulates with every other bone. So what that means is that every other bone in the skull at some point is in contact with this bone. So it's in that way sort of a cornerstone, kind of like the sacrum is to the pelvis. So that if your sphenoid is slightly out of whack, that can really affect your entire head and your entire body. Because your brain is like in there. Also, this little seat in here is called the sella turcica, a Turkish saddle, and in this little perfect little palace sits the pituitary gland, which is very important for regulating hormones and all kinds of other things. So also the eyes, all of the optical nerves and the muscles of the eyes pass through these little holes here. So the sphenoid is something that I work with anybody coming with any kind of visual problems, visual migraines or blurred vision or pain in the eyes, any issue related to the eyes. You really want to check out how happy the sphenoid is. So these parts, these are called the pterygoid processes, and if you feel with your tongue behind your last molar on the top of your mouth, go behind the last molar and you feel kind of like a little bump back there. That's this. And you don't want to really push on that with your finger because you can go on accident, right? So that's down there, and this is here, and then this part sits kind of right behind the eyes. I'm getting kind of a picture roughly about what's going on here. Cool. So the occiput, which is the big bone at the base of the skull. Maybe you could hold up the skull for us with the back facing the middle. Yeah, see that kind of triangular bone at the back? The very furthest back one. That one has a joint with the sphenoid called the sphenobasilar joint, and they do this kind of motion with each other, ideally. So that was a lot of technical information. And I just want to pass this around. I just want to read to you a little bit from one of my very favorite books on craniosacral therapy by Hugh Milne called The Heart of Listening. It's sort of dense, but I very much appreciate his work. He calls it visionary craniosacral work, and Hugh really gets into more of the energetic / spiritual metaphysical parts of this work. Whereas if you go to osteopathic school, you might get more about just how the bones move and how we can help restore them to their happy motion. So I'm just going to read to you a little bit about what Hugh says about the sphenoid. Okay. So the sphenoid is the home of light consciousness. It is the visionary bone, seat of the inner eye. The left eye is part of Ajna, the inner eye soul. The right eye part of Sahasrara, the crown soul. In Kriya Yoga, the sphenoid is Christ consciousness. The inner eye represents insight and has the ability to see what troubles everyone. A healthy sphenoid dreams with perception, clarity, and revelation, and may be clairvoyant. When faulted, the sphenoid dreams of death and dying. The sphenoid is occasionally represented in dreams by the image of a windshield. So, what I want to really connect us with is this, the sphenoid as the dreaming bone, and our insight, how we see present, hindsight, foresight, how we see ourselves in the world, how clear or clouded we feel our vision is. Sort of are the things I want to cook up a little bit tonight. So I would love for this to be a collaborative endeavor. In other words, if you don't happen to be the person on the table, I'd like you to be participating, and there are two ways in which you can focus your participation that would be helpful for me. One is sensing, and sensing is, in whatever way you do that, tune in to what's happening in the space, tune into what's happening in the person's body who's receiving, tune into me and what you sense or feel happening through me. I'm sure you all have different ways of doing that. It's not important how, it's just important that. Sensing. And the other way to participate is sending. So sensing and sending. Sending is, in whatever way feels comfortable for you, helping to define and hold a space of healing for the person on the table. And you can do that by defining a container and holding that container. You can do so by delivering into the container whatever feels appropriate, or you can actually work by sending directly into the person's body. Something helpful for them. So sensing and sending. But it's not a time to like space out and think about what you're going to do tomorrow or something. It's important for me that we all are very much present, but not only present actively,